Hello, my name is James Crick, and I'm the director of the CARESTREAM student program, which is an immersive learning experience in healthcare delivery and improvement at The Ohio State University. The purpose of the CARESTREAM student program is to offer future healthcare professionals, current undergraduate students, the opportunity to participate in real healthcare interactions. So the majority of the course is designed around principles of health system science, which teaches students how healthcare is delivered and improved to patients and populations. Meanwhile, students get to participate in experiential learning opportunities within clinical settings at The Ohio State University Wexner Medical Center. Here's a couple of pictures from our inaugural cohort in the spring of 2023, where you see students interacting directly with patients and augmenting healthcare delivery alongside clinical professionals. What we found with this course is very high clinician and student satisfaction. From an audit of 30 clinicians associated with the program who were accustomed to participating with CARESTREAM students across a variety of clinical learning locations, the vast majority were very satisfied with student performance in their work area. Similarly, we see really high student satisfaction, where the heavy majority agree that clinical learning experiences provide students with useful and relevant experience. And many students find that they gain a better understanding and clarity about their future in healthcare. Here's a couple of examples of student feedback, some comments that they provided about the course, giving a better idea of exactly how students benefited from participating in the course. One of the other items that we noted from a study that we completed for the CARESTREAM program in one of our clinical learning locations was that patients, as I circle here on the screen, noted that they had significant enhancements in their satisfaction based upon their participation with the students, and in particular identifying that they felt their care was more personalized and more proactive by being able to participate with the students. For the students themselves, they experienced significant learning and professional development. They found themselves growing psychologically and emotionally during their time participating directly with patients and alongside clinicians in dynamic healthcare environments. This course is structured in such a way as we have 3 total credit hours, which are eligible for program and major elective credit. There are 2 asynchronous didactic credit hours built around principles of health system science, and 1 experiential learning or clinical hour, which corresponds and requires 45 contact hours in clinical settings. All students who are taking the course for the first time are required to enroll in 3 credit hours. And we do have students who come back for additional offerings, and those are decided upon in terms of how many credit hours on a case-by-case basis. Experiential learning at Ohio State for 1 credit hour requires at least 45 hours of commitment over the semester. These opportunities are intended to develop students into well-rounded working professionals. This sets students up well for their graduate school applications, as well as for direct entry into the workforce. There are a number of course requirements that are required for all students prior to beginning in clinical settings. Specifically, students must submit a proof of vaccinations. They must complete a hepatitis B titer, which is a blood test to identify whether or not they have active immunity to the hepatitis B virus. They're required to submit an updated TB test, to complete a drug screen, and to complete a background check at the Ohio State University Wexner Medical Center ID processing. These are required to be completed prior to beginning the term, and more information is provided to enrolled students following their enrollment. How would a student enroll? You use Buckeye Link. The course is offered on a first-come, first-served basis. When you enroll in the course, you will select the CARESTREAM course, which is HTHRHSC 4191. You will then be asked to select a recitation section, and this recitation section corresponds to your in-person experiential learning time. So for example, if you chose an offering for your recitation, let's say Monday from 9 a.m. to 1 p.m., that would be the time during the semester that you would be expected to be in your clinical setting. Once the course is full, which is approximately 40 students per semester, The enrollment is closed. However, interested students can email me at the email address listed on the screen in order to identify if there might be an opportunity for them to still enroll. Our current experiential learning locations include the main emergency department, in our university hospital, a geriatrics unit, and with our case management group, and at Dodd Hall Inpatient Rehabilitation Facility. The activities that students participate in vary by site, and yet the aim is that we always have students who are contributing positively to healthcare operations while learning a great deal in the process. If there are questions, I encourage anyone to reach out to me at the email listed on the screen, and I'd be happy to discuss further. Thank you.